Okay, great. So I'm Vino, Dr. Vivek, one of the consultant neurologists leading the research side of channelopathy research. So we've officially launched our London Muscle Channel Research Group, and we do internationally leading research in muscle channelopathies, and we have a lot of international collaborations. And recently, myself and Ivona, our research nurse, presented at an international conference, and that's us there presenting. So we're quite active in the research world. And I'm just going to talk through some of our research projects so you can get a sense of the scope of the research that we do. So the big research project that a lot of you will have been involved in is our clinical trial that Deepa mentioned. So we looked at 2 treatments for symptomatic control of myotonia to help reduce the symptoms of myotonia. And I won't go through, Deepa's already spoken about mixolydian and lamotrigine, but they're both effective treatments for myotonia. So we really compared them together, head to head, to decide or try to understand which one is going to be better for treatment of myotonia, both in terms of efficacy, so which one reduces myotonia, in terms of how bad myotonia is, but also in terms of side effects, which one is better tolerated for our patients. So we've completed the trial now, so that, that's really thanks to everyone that's been involved in the trial, and we're really very grateful for that. The analysis has just been completed, and we're just really finalizing the results now. So once the analysis is completed, it does take a few months so that we can present and disseminate the results of that. So in the next few months, we should be able to disseminate the results directly to you. And that will be really in the form of a paper, and we can discuss the results of the paper, with everyone that's interested. So, and we can hopefully present the results at the next patient day in this format as well. So, it should be coming to you very soon, and we're very grateful for your participation. But we know that lamotrigine is effective, and we know that there are some people who can't have mixolydian because of the reasons that sort of Deepa went through, because of heart problems or reflux, for example. And so we do have several people who are on lamotrigine. We know that it works. And so Ivona, our research nurse, I'll just reduce this because has been collecting data on our patients who have been on lamotrigine, to understand, outside of a clinical trial, in the real world, how is lamotrigine working for our patients. And so we've looked at the data at 6 months, from starting lamotrigine, and then again at 6 months. And in our patients who are on lamotrigine, we've shown that actually in the real world, it is working. So this is kind of the MBS score, the myotonia score that a lot of you will have done with us. It's a sort of score where you say how bad your myotonia is. And it's up here at 4, which is worse before you start lamotrigine, and it drops down to being not so bad at 6 months overall on average. So lamotrigine does work even in the real world in our patients who are on lamotrigine. So, in the trial, it's shown to be effective, but even in the real world in our patients who are on lamotrigine, we've shown that, that translates into the real world. And we're collecting data ongoing in terms of side effects as well, so that we know in the real world how it translates. And so, again, thank you to everyone who has, worked with Ivona to get to, so that we can collect that data. And we'll continue to do that. So the other large part of our research involves MRI analysis. And so we have published, and we've already done an MRI study looking at periodic paralysis in particular. And there are some important findings that we've already found or discovered. And I'll just touch on a few of these things, and then talk about what our future plans are. So in MRI, we've found that there are different patterns in the way that the muscle is affected, depending on what gene you have. So sodium versus calcium particularly, and even with the potassium channel with Anderson-Towle syndrome. So the way that the muscles are affected when we look at the MRI does look different, and that's helpful in diagnosis and also in assessing the muscles. So that the muscles are affected differently on MRI. And we do see that the muscles can change with age, so that as you get older, the muscles look different in periodic paralysis. But we need to identify and find new MRI techniques to see how the muscles look in younger patients and to detect muscle changes quicker in periodic paralysis. And so that leads into what we're planning to do in our upcoming research. So we're planning to create a new research study, which hopefully will be kicking off in the near future. And Dr. Assad, our new research fellow, will be leading on this. And it's a new MRI study in periodic paralysis to see if we can identify some new MRI techniques to look at the muscle with these techniques to identify muscle problems earlier on, and that detect changes in the muscle earlier on in periodic paralysis. So this is going to be very exciting. And if we can detect changes in muscle earlier on, maybe that can inform treatment and what we do in periodic paralysis. So keep an eye out for when we kick this project off. And if you're interested, do get in contact with. So several of you with Anderson-Towle syndrome would have been involved in our cardiac monitoring, our remote cardiac monitoring, and this was run by our master's student, and we're very active in involving master's students in our research team as well. Our master's student led in a remote monitoring project where you had a little device that linked into your phone to see if you could pick up ECG changes at home without seeing a cardiologist or having to come into hospital to have an ECG, for example. And she did find that you could pick up some ECG changes, but there were a lot of technical issues as well with interference with the recordings on the phone. So, it may be that we need to look at newer devices or different devices, but she also is going to have a look if she can see if the ECG changes that she did pick up can be correlated to loop recorders or the ECG recordings that cardiologists do. So we'll need to take this a bit further as well. Again, thank you to all of our patients who did this study. It's very helpful. And our cohort study is always ongoing. So this is the study that when you come into clinic, or you might have a bunch of documents posted out to you, which is like a registry. So for all of our patients who want to be involved, you can sign the consent form, which has a lot of information on it, but you don't need to do all of it. And Ivona, our research nurse, sends this out to you and does the consent form. And it's a registry to be part of our research cohort. So if there's new studies, you'll get information about it. And it also allows us to have an understanding of how your condition impacts you. So in the pack, there are some questionnaires like fatigue questionnaires, pain questionnaires, and you fill that out when you come into clinic, or you can take it home and post it back to us. And when you fill that out, we keep an understanding of how over time your condition affects you. And that really helps us develop an understanding over time and informs our research. So that's very helpful to be involved in. And that's an ongoing study that we've had for a long time now. So that's very helpful for us. And an example of how this cohort study has been helpful, and I think I showed this last time as well, is information on pregnancies in channelopathies. And so we were able to show that, as Deepa sort of mentioned, we showed that myotonia worsens during pregnancy. And that's information we pulled out from the cohort study, for example. So it's very helpful for us that you're involved in the cohort study. Now, the other arm of our research is the electrophysiology research that we do with Rupi Maniko, our electrophysiologist. And an example of that is at the moment, we're doing electrophysiology study to understand the new channelopathy genetic changes that cause weakness in these new channelopathies that cause congenital myopathies or young onset weakness in patients. Okay, so these are different to the channelopathies you have. And we're trying to understand the effect of these genetic changes on the electrical currents in cells. In this kind of setup that you see, that's what the sort of electrophysiology setup looks like. And we use that to understand the current changes in cells. And this is a parallel arm of research that we do in electrophysiology. Sarah Holmes, our physiotherapist that you've all met, is also doing research, and she's recently run some research where she's set up 2 sessions of PPI. And what that stands for is patient and public involvement. And these are focus groups or focus sessions with small groups of patients. And the real idea is to understand what's relevant to you and what's important to you, and allow you to tell us, give you a chance to really, talk to us and us to listen to you. And that allows us to get an insight into what's important to you. And we sit back and analyze that. And that allows us to inform future research. So Sarah's led 2 sessions now, and she's reviewing the data from that to direct future research. So that's the scope and breadth of all the different parts of research that we're doing at the moment. And so, really, really key that you're engaged, and, we really couldn't do it without your engagement and your involvement. So thank you. And if you're interested in being involved in research, do drop me an email. Thank you very much.